So today we're going to show you a ankle tape job to prevent inversion, which is the ankle turning in, and eversion, which is the ankle turning out. So before every tape job we use an adhesive spray. This one's called a toughener pre-tape. There's lots of different brands, so you just spray a light bit around the areas of the foot that are going to be taped if you have it. We also use what's called a heel and lace pad, and this just helps prevent blisters on the front and the back of the foot. So is this the instep? Is this your instep? Okay. So you place one across the instep and one across the Achilles tendon in the back of the heel. So the important part with taping is to make sure that your patient maintains a proper position. If we're trying to prevent a turn in, we need them to really push the foot outward and keep the toes back. So when you start your tape job, the first 3 strips of tape have no tension in them. So they're really just laid on the skin. And you want to go at the part of the leg that starts to taper down into the tendon so that we're not choking the muscle, but we're not too low so that the levers don't prevent the mechanism of injury. So when you lay your first 3 strips on, they're going to have to go in a bit of a teardrop shape. They can't go straight around the leg, or they're not going to lie flush with the leg. So after your first strip of tape, you'll go halfway down, do a second one, halfway down the second one, and do a third. So the next piece of tape is called a stirrup, and we're putting it around the bottom of the foot. So this is the one that's instrumental in keeping the foot from turning inward. So make sure your patient keeps their foot in the air. Start on the inside of the leg, around the bottom of the heel, and you're pulling up on the outside of the foot. The second stirrup will go 50% in front and then to the outside. How would you explain that?
Crossing over.
Crossing over.
50% behind the first strip.
And then the third will start 50% behind the first strip, down under the ankle, and end up in the front. So it creates a fan on the inside and the outside. So once you have those on, you'll want to make sure they're secured. Again, these strips of tape have no tension in them. They're just laid on the skin. So you'll want to cover everything up, and that will help to prevent any blisters from occurring. So once you're down on the bottom of the foot, you're going to go to the outside ankle bone. So this would be the inside, this would be the outside. You'll place a strip of tape over the outside, down across the bottom of your foot, up across to the other side. This makes a figure 8. And then you can lay the tape down. The next is what we call a heel lock. So you can place the tape on the instep of the foot, down onto the bottom of the foot, come up to the opposite side of the heel and wrap around. So you're back to the middle. And now we're going to lock the heel on the opposite side, so down on the outside of the foot. Wrap it around the inside of the heel. And back to the middle. So we do that twice. So you're going to start on the outside ankle bone, down across the foot, to the middle again, and around the back. If you're comfortable, you can continue into a heel lock. So down into the foot, up and lock the heel on the outside, across the foot, under and lock the heel on the inside. Just make sure any windows or wrinkles that you have are covered, because again, those will turn into blisters. So you want to make sure if it's actually preventing the inversion mechanism. Great. We'll fake it. It's not working. And then you can close the tape job all the way up, which is just the opposite of what you did at the beginning. And before the person returns to sport, you'll want to make sure that they do some walking, some jumping, some drills before they actually go in to play their game. So now we're going to do an eversion ankle tape job. So we're preventing, okay, so it's to prevent eversion, but we're taping the ankle in a neutral position, so we're not forcing it to the outside. So still use your tough skin if you have it. You don't have to use a lot. Have your heel and lace pad, one on the instep, one on the Achilles tendon in the back of the heel, and make sure that your patient stays in this position. So our first 3 strips of tape are the same as before. They're just anchors, so no tension in the tape. They shouldn't be tight. We're going to go halfway down the first strip of tape to put on your second, and the same thing with the third in your teardrop shape. So for this one, when you put on your stirrups, they're not going to start on the inside. They're going to start on the bottom, and you're pulling up equally on both sides. And you'll still create your fan. So 1 strip to the inside, 1 strip to the outside. And then the opposite for the last piece of tape. So you'll want to secure those, and again, you can go all the way down the foot. Just make sure there are no windows or pieces of skin poking out. So again, we're going to do a figure 8. Start on the outside ankle bone, go across the top of the foot to the outside, and up and across. You're going to do a heel lock, so you're down to the bottom of the foot, going to the outside of the heel, wrapping behind, and up to the top of the foot again, to the other side, locking the heel on the inside, and finishing the first set of figure 8s and heel locks. So for the second, start on the outside ankle bone, down across the top of the foot. That's your first figure 8. Down to the bottom of the foot to lock the outside part of the heel. And again, to the inside. So in this position, you'll want to make sure that inversion and eversion are limited by your tape job. And then you can close it off all the way up to the leg. And you'll just want to check their circulation so you can pinch their toes, make sure that their color comes back within a couple of seconds.